Thanks everyone for participating in this webinar. It's a pleasure for us to show some important information on tobacco control in Nigeria. And I just wanted to make a short recap, tell a story about the history of working in tobacco with the Institute of Clinical Effectiveness and Health Policy in a joint work with colleagues of the Center for the Study of the Economies of Africa. We have been working now for 18 years in a multi-country initiative to develop economic and burden of disease information on tobacco-related diseases. For many countries now in Latin America and expanding to Nigeria and India. And our task is to generate actionable evidence of high quality for policymakers in the formats they need to be useful. And well, as part of this journey, we generated a mathematical model that has been applied in many countries in Latin America: Argentina, Bolivia, Brazil, Chile, Colombia, Costa Rica, Ecuador, Honduras, Mexico, Peru, Paraguay, and Uruguay. And it has the capability of depicting the burden of disease in terms of many epidemiological parameters, as well as the financial burden. It has been a challenging work, but a fruitful one, because many policies have advanced since we started. We generated a variety of formats for showing this information, including infographics, information for journalists, scientific publications, technical reports, and videos available at the webpage you see there. So as an important outreach advancement, since 2019, our team had the opportunity to join this group of CSEA, first with Dr. Chukwuka Onyikwena, Dr. Adeniran Adedeji here at the call, Dr. Precious Akano, and many other colleagues. And we cooperated to produce these estimates of burden of disease for Nigeria. We began with data analysis for disease burden. We followed with data analysis for indirect costs and direct costs and cost effectiveness of taxation. And we also did some work on labeling, cigarette package labeling. As part of this collaboration to publications in high impact scientific journals have been published. And so we as a group are very happy to collaborate with, have been very excited and happy to collaborate with these colleagues. And we think that this is an example of South-South collaboration between IECS in Latin America and the CSEA in Africa. And it is well in line with the Sustainable Development Goals 17 that refers to the need for cross-country collaboration. So I leave you with Natalia and Agustin, who will present this work. We can hear you, Nati.
Sorry. Hi, everyone again. Thanks for joining us at this meeting today. I am Natalia Spinola. I'm the coordinator of health economics here in the IECS. And we introduce this study. The result that I will present today is part of the project the health economic social burden of tobacco in Paraguay, Uruguay, Bolivia, Honduras, and Nigeria. and the expected gain of the full implementation of the main tobacco control measures, these 4 interventions: taxes, plain packaging, advertising bans, and a smoking-free environment. The main objective of this project is to empower key local actors, and here's decision makers, civil society organization, and other relevant stakeholders, with information and tools to promote implementation of the tobacco control policies proposed by the tobacco control best practice packages, the WHO MPOWER measures. Here is the intervention that mentioned in the title. And the specific objective here was collect data from the country's epidemiological, clinical, and cost information, and estimation of disease and economic burden associated with tobacco use, and modulate the potential effects of implementing tobacco control policies. Then networking between partner institutions for promotion of the tobacco control, with training and capacity building. This project was made possible thanks to the support and funding of the Cancer Research UK, and the information presented here in the webinar is part of the study and with collaboration with the Center for the Study of Economies of Africa. Here is the work team that participate in the project. And now we are present the result from Nigeria of this project in charge of the Agustin. Agustin Casarini is researcher at the IECS. And so one clarification. Please feel free to ask all the questions in the question and answers section during the presentation. At the end of all presentation, we will open a space to more question and answers. So Agustin, you have 15 minutes to present. Go ahead.
Okay, well, thanks, Natalia. Hi, everyone. Thanks for having me. Well, as Natalia was mentioning, the idea of these few slides, it's first to show the results that we got from this study. But before that, I would like to do a quick recap on what is this model like and what does this model in order to get those results. But I will try to be quick just to not bore the audience. Well, this is a microsimulation model that follows the natural history of different cohort of individuals. This natural history includes having results for different kinds of diseases. All these diseases are related or attributable to tobacco. And those diseases are basically coronary and non-coronary diseases, strokes, COPD, pneumonia, influenza, lung cancer, other 9 neoplasms, and diabetes. The outcomes that this model will produce are related to, well, the burden of disease, that would be death and incidence of diseases, but also results in terms of quality of life as QALYs and DALYs. Also, this model produced results in terms of economic burden of disease in different categories, and also it will allow us to estimate the impact of different tobacco control interventions. Lastly, well, this model is run in Visual Basic and using Excel. Well, how does this model do this? Well, basically what it does is to estimate an hypothetical cohort of people. Two cohorts, whether one is a cohort of individuals that will represent the country if no one would be smoking, and the other would be considered the current prevalence of smoking and also the current tobacco consumption that the country is having. So estimating the life of these two cohorts and comparing it and making and differentiating those cohorts would produce the attributable results to tobacco for that cohorts. So we would have results in terms of health, as I've seen say earlier, getting as an outcome the total death, incidence, and quality of life because of tobacco, how tobacco impact on those. And regarding the economic parameters, we will have estimations on the direct medical cost incurred in diseases attributable to tobacco. The perspective of this direct medical cost is the one of the health system of Nigeria. And also we produce the results in terms of productivity cost, including early mortality, that would be the loss that we have in productivity because people die sooner because of tobacco, and also because of disability, that is that people cannot work at 100% of their capacity because they are ill. And lastly, the informal caregiver costs that include the cost for a family member that should take care of someone in the family that is ill because of tobacco. This is a particularly interesting thing that the model include because, well, mostly of that burden relies on the women of the households. Lastly, what we can do is, and what the model does, is simulate in possible interventions and what would be the savings that we get if we do those interventions and follow the golden standard of the MPOWER. Next slide, please. Well, jumping into the results. First one, I want to show and talk about the results in terms of the burden of disease. Tobacco is responsible for about 22,000 deaths a year in Nigeria. This would be 3.5% of the deaths from tobacco-related diseases. The majority of those deaths are related to respiratory diseases that include COPD, pneumonia, influenza, tuberculosis, with 8,000 deaths a year. And also, in terms of incidence, respiratory conditions are the ones that are doing the worst, followed by cardiovascular diseases and also stroke. Even though diabetes has the lowest burden in terms of death, well, it's not the same in terms of prevalence because it causes around 66,000 prevalent cases of diabetes attributable to tobacco. And in terms of quality of life, well, we see that 144,000 years of healthy life are lost due to tobacco. Yes, this one. Well, going up to the economic results, the total economic burden in Nigeria, it's about 630 billion nairas. That would be $1 billion. No, this is 0.4% of the GDP or 11% of which the country spends on health. For this burden, this total burden, 78% is due to direct medical costs. This shows us, or this could tell us that the tobacco is generating a huge stress on the health system, but also it has a non-negligible effect over the society and over the population, not only because of, well, people finally the ones that get ill, but also in terms of productivity, causing around 78 billion nairas in terms of productivity due to early mortality and disability costs, and also a huge burden in terms of informal caregiving, being 9% of the whole burden. In terms of diseases, well, COPD is the principal responsible of the huge part of the burden, followed up by stroke and cardiovascular diseases. And, well, tobacco tax revenue only covers 7% of the direct medical costs. So this is a hint of what we are looking for, trying to implement policies for controlling the burden of disease of tobacco. So what we can do and what we should do with these results, at least for me, I think we have to try to do something for controlling the tobacco pandemic. And what tools we have for doing that? Well, the MPOWER gives us some ideas on what we can do with tobacco and what we can do to fight tobacco. And still, we have great challenges in order to fully implement the recommendations from the WHO. In Nigeria, particularly, I think implementation of smoke-free environments and taxation, it seems a bit lack, but it can generate, it can generate great amount of benefits if we keep on implementing and improve the compliance of those measures. In terms of taxation, for example, well, one of the results that we have from the model, if we assume an increase in prices of 50%, and that won't be getting to the golden standard of the MPOWER, that will be 75% of the current price of tobacco due to taxes, would generate, well, a lot of death avoided, for 45,000 deaths avoided, 137,000 illness events avoided, and also would generate a great amount of 26 trillion nairas in terms of savings. Now, these savings include the ones that are because of direct medical costs not incurred and avoided productivity costs and informal caregiver, but also the benefits of increasing the revenue because of taxation for the government and the federal agency. Regarding the other measures, well, smoke-free environments, also a policy that can be implied and can improve much in this situation, would generate, well, after 10 years, savings for $8 trillion in terms of, again, direct medical cost avoided and also productivity costs. And, well, the amount of 15,000 deaths avoided and 42 illnesses events avoided. Of course, well, getting more advertising bans and also improving the labeling and the health warnings that are on the cigarette package is also will generate a great amount of savings, about 5 and 6 trillion nairas after 10 years. And also it will generate to avoid a lot of deaths. Next slide, please. So just as a conclusion, well, it is shown that tobacco, it's continued to represent a significant burden of disease in the world, but also in Nigeria. Well, we have a toolkit to be used in order to fight this burden and, well, implementing the measures that are suggested by the MPOWER, and also I invite you to be creative on generating new ideas to fight this tobacco epidemic, would prevent, well, a significant amount of death and illnesses events, and will reduce the stress, the financial stress that the healthcare system have, and also families, because of well, losses in productivity and caregiving. And, well, of course, in case of families that incur in out-of-pocket expenditure, well, that would be safe in using this kind of policies. And also it can generate extra resources to the government if, well, we increase taxes, but also if the government can save money for not incurring in direct medical costs, and also will raise the productivity. And, well, finally, well, the idea of these results, of course, is to raise awareness about the situation and to encourage and to, yes, encourage you to advocate for, well, doing something with tobacco, and try to improve and do decisions based on evidence, considering the most effective and efficient measures that can be possible in order to control tobacco. So, well, many thanks for hearing me.
Thank you, Agustin. Thank you for the resume. Okay, now we would like to invite two panelists to share their insight about how we can make the best use of this information generated to support public policy decision making, and if there are other initiatives in the region. So, first of all, thank you for panelists for sharing this panel with us and for the enjoy in the meeting. And now I introduce the Dr. Chibuike, Program Officer, the Nigerian Tobacco Control Alliance, coordinating the programs and activity of Alliance. So, Dr. Chibuike, I pass the floor to you. I remind that you have 10 minutes to present.
All right. I hope you can hear me.
Yes.
All right. Good afternoon, all from Nigeria here. But I need to, when you're in the midst of researchers, they tend to assume that you are a doctor like them. I have to say that for now, I'm not a doctor, but I'm an advocate, a well-known tobacco control advocate in this country. So I think I need to correct that. So some people who go and say, where did you become this doctor? So I think I need to correct that. All right, thank you. Having said that, I'll try and be sure that I use just 10 minutes, though initially I was told 20 minutes, but that's not a problem. Okay, now looking at it is just to conceptualize the reports of the findings, how it can help us in Nigeria. And as you said, I work in the Nigerian Tobacco Control Alliance. It's an alliance of people, tobacco control advocates, scholars that are interested in tobacco control in Nigeria. We are based in Abuja. Next, please. Okay, so I have to give us some of the things. Not that Nigeria have not done anything about tobacco control. We've done some things. Nigeria is a member of WHO FCTC around 2005. Then from then, it took us now another 10 years to domesticate the FCTC. That is in 2015. We domesticated by enacting the act called the National Tobacco Control Act of 2015. Then it took us another 4 years to be able to get regulation to implement the act. That's 2019. Then Nigeria ratified the Treaty on Illicit Tobacco Trade. Then enforcement of some aspects, mark that word, some aspects of the act and regulations are going on. Next, please. Okay, so these are some recent tobacco control, some of recent tobacco control efforts in Nigeria. Okay, no, please, next, please. This is a repetition. Next, please. All right, so from the results, when I was going through the results, this is what I lifted from the results: smoke-free, the dead, the money that government would have saved, labeling, and the GHW, that is graphic health warning. Some call it pictorial health warning, but in Nigeria we also call it graphic health warning. Ban on tabs, that is tobacco advertising, promotion, and sponsorship, and tax increase. But from these figures, and looking at WHO figures and all the rest of them, you see that Nigeria is on the high side. And this may lead to catastrophe if nothing is done by policymakers to tame this. If you look at the death that is happening from smoke-free, labeling, ban on tabs, tax increase, these are things that are alarming. People are dying in this country, you know, and I think it's what the policymakers, the enforcers really need to look at and know that there is fire on the mountain, as we say here in Nigeria, to see how serious the whole thing is. Next slide, please. Okay, now I just try to look at Nigeria and MPOWER. Where are we with MPOWER? Monitor. M stands for Monitor for Tobacco Use and Prevention. The country have not really done excellently well to monitor the policy. And that's why we say thank you to your organization and CSEA, because most of the things we have, records we have, are those that are not indigenous. So, but for us in the Alliance, we added another M in that monitoring. That is monitor the tobacco industry. Not only to monitor the compliance, but monitor the industry themselves. Because what we've seen over the years in Nigeria is that industry interference is really a big problem. So like in my organization, we have some activities we call monitoring of industry. We monitor what they do because they try to always scuttle the efforts of government and advocates to see that tobacco is properly, effectively controlled. So we don't only monitor only the monitor the industry. So protect the people from tobacco use. In Nigeria, I must say that the smoking in public places, nothing really has been done. Nothing has really been done. People smoke in public places at will, which is this report is making us to use it to make government understand that people are dying because of this. That young man, that young lady working in a pub, what is his crime? Because he's working there, you're smoking anyhow, he's inhaling it through secondhand smoke, which is as dangerous as smoking. One about dangers. Well, on this, I can say in Nigeria, a lot has been done. By next week, the moratorium given to tobacco industry for the second phase, because Nigeria is just on the second phase of the graphic health warning, will commence. So we are in the second phase of graphic health warning, but I think that more needs to be done. The relevant enforcement officers need to enforce this. Let it not be only within the city center, and the industry will push the other product that may not have these warning labels to the hinterland. Then enforce ban on tobacco advertising, promotion, and sponsorship. Yes, in Nigeria today, I must say, if you look at our conventional media houses, you won't see any advert, so to say. But the tobacco industry has taken their advert to the digital platforms. So the digital platforms, they are not being regulated. And they've done another thing, the subtle advertisements through our movies. You watch some movies in Nigeria, you see some unnecessary adverts of tobacco products. So they're no longer on the conventional media houses, but they're now devising another means. And the policymakers, it's as if nothing has really been done. They are having free day on the digital platform. Raise taxes. Yes, for us, Nigeria should get up to 70% of WHO recommendation. In Nigeria, the taxes that has been raised for us as advocates, the taxes have not really shown in the prices of the cigarette products. The taxes are being consumed, absorbed by the industry. So the prices are still, the difference is not much, just opposing it with the inflation in Nigeria. You see that the tobacco products, the prices are still cheap. So the government should raise taxes in a way, because taxes is a win-win situation. Government will make more funds and the consumption of the product will drop, because people will not be able to afford it. Tobacco, as we say in Nigeria, should be a luxury product. It's not a product that everybody can get easily. And we can achieve that through effective taxation, not what we have in the country now that does not really show in the prices. Next, please. Okay, so this research as a tool, that is where we come as advocates. Okay, this is an indigenous research work, as I said. It's not before that when we say some things, the industry will try to say, no, the foreign people have given us something. No, but this is an indigenous research done by a reputable organization, CC and your organization partnering together. So when we are talking today, we are no longer talking that WHO says. We say that based on research done by CC, an indigenous research group. So nobody can fault that. You know, it's an empirical research. And this is more updated. You know, it's a recent research. So we can't, somebody can't tell us that this is what happened last 10 years. No, this is a research of today. And the research is done by a reputable organization. As I said, CC is well known. It's a reputable organization, and it is not ambiguous. When you pick it and read it, when I was going through the results, it's something that is so easy for you to understand. It does not have all those more, you know, statistical jargons that may confuse somebody, but it's so easy to understand. And I say that this research can also use to vindicate advocates for effective tobacco control, because a lot of times the industry push some researches that are just in their favor, but this should be able, you know, to help the advocates to counter most of the things they are saying. And also it can help us to go down to the subnationals, because what we see in Nigerian tobacco control is mainly everything is happening within the federal. Nothing is really happening within the state level and the subnationals. But with this research, it can help us to push so that this tobacco control will trickle down into the states and the subnationals. Next, please. All right, so for the policymakers, it will help the policymakers to make well-informed decisions for the benefit of Nigerians. It will counter the researches of the industry that is always skewed towards false claims. We know that industry will come with some false claims of how they're giving job, how they are doing this, but this research will help to, you know, counter all those their false claims. It will help the law enforcers to effectively enforce the existing laws and policies toward tobacco control in Nigeria. So as I said, we have existing laws in as much as there is room to improve on the laws, but we are advocating that even the laws we have in the country, how can the enforcers greatly enforce it? So I think that this research is so apt, and it has been added into our toolkits to be able to advocate for policy change and make sure that Nigeria tobacco control laws and regulations are effectively implemented. Next, please. Thank you. Sanu Dalo Nagode Oshe Sokson. I think I did not use more than 10 minutes. Thank you so much.
Yes, you have to time. Thank you. Thank you. It's the great presentations of the situation of the Nigeria in this, the intervention of the MPOWER intervention. So thank you very much. Now, the second panelist is the Dr. Adedeji Adeniran. Is the role of the state in MPOWER policy implementation and director of the Centers for the Study of the Economics of Africa.
Thank you.
Thank you.
Okay, so okay, great. So thanks so much for this great event. So my presentation is, I want to thank Agustin for that very nice presentation. Taking us through the landscape in terms of disease burden and also the benefits of implementing the Empower framework more holistically in Nigeria. And I think I like the center, the way this is positioned, not just picking one. Not just the aim in terms of taxation, not just plain packaging. Combining everything together will make it more effective. And I think that's it's one thing we've in research that we talk about these contrasts piecemeal, but I think reinforcing the fact that we need to actually make sure that they work hand in hand is what will make it more effective. So I want to actually then jump on that kind of conversation around the Empower to ask the question, in Nigeria, even though we have seen over the past years, my friend Chibuike just highlighted some of what they've been doing in the advocacy landscape to ensure we actually deliver and implement always been that there's a policy fragmentation. And I want to speak to that in terms of one reason why that is why much progress in that space. So when we look at Nigerian economy, we have tiers of government. There is a federal, there is a state. But when you see in terms of the landscape of tobacco, sorry, next slide. I want to make it fast so that I could do this. So when you look at the landscape for tobacco control in Nigeria, it has always been centered around national government. If you look at the next slide, I try to draw attention to and track, next one, and track the trajectory of tobacco control in Nigeria. And what you see is that most of the effort has always been centered around the national policies. Very few has actually come up from what the state government is doing. Without including state government in tobacco control policy, I think we are losing a lot. And I can highlight three things we are losing. Number one is policy fragmentation, whereby what federal government is doing doesn't actually work across what the state is doing. And when we have that fragmentation, in a way, it gives rooms for regulatory capture, especially by the industry that can penetrate the state in order to weaken whatever policy is coming from the top. So again, we need to actually avoid regulatory capture and we need to work with the state. Thirdly, we are underestimating the costs of tobacco and overestimating the benefits when we just look at what the state government is doing. And that is why we need to be very holistic, very deliberate in our attention, in drawing attention to what everyone is doing. So my kind of message this morning is the fact that state government has a lot of things to do in the tobacco control space. And in this presentation, I just want to point to each of the MPOWER and highlight some roles for the state. So next slide, please. Yes. So in next one, sorry. Yeah, next one. Okay, so you can go to the next one too. So in the Empower framework, we can, so next one, sorry. We can talk about how do we bring in states into, sorry, can you go to the next slide? How can we bring in states in that conversation? And in the first one, to monitor tobacco use and prevention. There are many things that the state government can do in order to support government. For example, when you look at tobacco data in Nigeria, we still have some data at the national level. But when you want to actually speak to what is going on at the very local level, maybe the local government level, sometimes when you want to even see what is going on at some jurisdiction, like the border town, and some kind of areas, even rural urban comparison, there are kind of weakness in those data. And I think state can also be able to support in terms of creating structure so that we understand the prevalence issue within that state. They could also involve in media monitoring, because we talk about advertisements. And to some extent, how do we ensure that even though federal government cannot be everywhere, but state has a kind of agencies, almost they could actually have better penetration in order to see what is going on everywhere. Also, prohibition in terms of free tobacco products, it's something that actually constitutionally even lies within the state, because states most time regulate places like club, hospitality centers, where so much of this takes place. So in a way, if we exclude states from that conversation, we might not make much progress in terms of some of the policy we are making. Next slide. So the second one, I mean, regarding to protect people from tobacco smoke, one key policies that we have highlighted in this presentation is placing absolute ban in public spaces. And again, it is the major role of the state. In fact, the role, it is the state that has this role. And when you look at Nigeria, only 3 states actually have explicitly banned smoking in public. And so you ask the question, what is there? Some other states have prohibited it, but it's just executive kind of pronouncement, not lacking legislative backing. And sometimes when you go to many of these places, you are aware that many people are not even aware of such a ban. So we need more kind of states to come in order to take their role in actually implementing some of these policies that we already have a structure for at the federal level. It's just for state to kill into it. But also in terms of promoting educational awareness and campaign on tobacco, state also has a key role to play in this area. Next slide. So in the next point is around to how far I have to quit tobacco smoke. And one experience I have recently is actually visiting a number of states as part of our tobacco control research and also policy dissemination. And what was eye-opening was the fact that in each of the states, we went to 6 states, and in each one, we were asking policymakers to and people within the health ministry to really just raise their hand and tell us if someone is actually in need of, wants to quit smoking within a local government or even within the state, can they mention 2 to 3 places that such a person could go to? And very shocking that none that in just in one state that we had someone mention one health center that offered that offer to quit opportunity to smokers. So it's just point to the fact that we don't have such facilities. And most times, I mean, in places you want to actually maybe situated within health system. Again, most of the health system are actually controlled in terms of primary health care and secondary health care are controlled by the state government. So you have to see that without states coming into that process, we won't actually have a very effective way of even helping smokers in whatever ways in order to help support them to quit. Next slide. I mean, when you look at other aspects of the empower in terms of warning around the danger of smoking, and especially to youth and children, again, state has a role to play because they control the education system. And public education campaigns are better held at the state level, whereby they can better address the local peculiarities, the language issues, and also because they control some of the medium of communications within the state in terms of media and everything. We can actually achieve much in terms of to warn tobacco smoking without also bringing the state into that conversation. Next slide. So also to enforce bans, I think my colleagues has mentioned some of this in terms of advertisement and the innovation that tobacco industry has come up. I mean, moving online, subtle advertisements in movies, and all of this has emerged in recent times. And that called for collaboration, not just between federal government and the state, but also federal government and also now private sectors, such that we can actually control some of the information. But more importantly, it also speaks to regional and global cooperation that needs to actually take place, such that global digital tools can be effectively controlled. Next slide. So the very last slide is around tobacco taxes, and as in Agustin's presentation, he highlighted the fact that tobacco control, taxation is one of the most effective tools. Now, in the Nigerian law, federal government actually have more roles in terms of implementing some of the taxation on tobacco. And over the years, they've been increasing it. Of course, we've made the case of the fact that the increment is so short that it's not actually making the desired impact, and that calls for the need for more improvement. But for us to have more improvement, we need also kind of key stakeholders to agree on what we need to do. And that's actually one role that state government can play in order to support government, also be an advocate in federal government initiative to increase tobacco taxation. One idea that's actually emerged is the fact that when you talk about tobacco control, one of the problems of limiting factors is the fact that there is also no fund in order to implement some of the tobacco control initiatives. And the idea of raising tax and earmarking it has emerged as a major leeway to do that. So we can actually also bring in state government to also see the physical and health benefit of this. And so that we can actually say, okay, when we raise these taxes, how do we spend it? How do we earmark it? And how do we use it more effectively for tobacco control? So there's a lot in terms of the political economy of tobacco control in Nigeria. And without addressing those political economy, we might not make progress. And that's why I've tried to really highlight some of the key agencies, private sector and state government can play a key role in tobacco control as well. And without having this broad, holistic partnership, we will not have effective and deliver on our agenda and tobacco control in Nigeria. So thank you so much.
Okay. Thank you, Doctor. I have it in time. Thank you. Right. Thank you, Dr. Adeniran. Now, with the last but not the least, I'm pleased to introduce Dr. Sunda Shisa. Is Program Director of the WHO Framework Convention on Tobacco Control Knowledge, Hub on Tobacco Taxation based on the University of Cape Town in South Africa. He has extensive experience providing technical support to countries in the area of tobacco tax modeling. His research portfolio spans a broad spectrum, including exploring the equity impact of tobacco use, investigating illicit trade in tobacco products, and delving into the political economic of health taxes. So, Dr. Shisa, I pass the floor to you.
Thank you very much, Natalia, and to the IECS team for giving me the opportunity to just give some thoughts on some fantastic research that's been developed by colleagues in Nigeria by CSEA and IECS. So what I'll give is just a general overview, I think, of what I think some of my thoughts are, having looked at some of the results and how this complements very nicely, I think, with some of the other activities that are going on in the continent. Next slide. But really the thing I want to sort of just emphasize, I think, as I start all of this, is the fact that the African landscape is pretty complex. And that's something we see on a number of different parameters. So the fact that this type of research is taking place on the African continent, we need to get a sense of what is this complexity we're referring to. Next slide, please. And really, some of the issues are probably pretty well known, but not always known in context of what's actually going on in terms of tobacco control and this type of research. So we know, for instance, that there's a rapid, population growth, right? We have 1.4 billion people living on the continent. It's the youngest continent by age group. So median age is roughly 18.8 years. That's the youngest median age on any continent in the world. There's rapid economic growth, 3.6% projected by IMF for 2023, 4.2 in 2024. In comparison, just for comparison's sake, Europe is looking at 1.4% in terms of growth projections or less, for this year and for next year as well. So, a lot more is going on the continent of Africa, just economic-wise as well. In terms of foreign direct investment, the continent has been attracting, massive amounts of money to the shores. Over 80 billion in 2021, that halves to about 45 billion in 2022. But you can see that there's quite a huge appetite to attract foreign direct investment onto the continent. And this is important because many country governments don't really see the distinction between, attracting investments from tobacco industry versus attracting investments from other industries out there. So these are important factors to consider as we sort of put all of this information together. Next slide, please. Within that context also is the fact that for many countries, the prevalence of adult daily smoking is actually quite low. I believe Nigeria is somewhere around 8% or thereabouts, and it's not that much. For many countries, the bigger problems in terms of the public health issues that they think they're facing immediately, right? But within that particular issue is also the fact that there's a growing youth smoking problem. So across the continent, about 13% of young adolescent girls are already using tobacco products, and this trend is growing, right? We also have a situation where there are weak tobacco controls in many countries. Fortunately, Nigeria has domesticated the WHO FCTC provisions, but even it's struggling in terms of trying to make sure that it reaches the highest levels of these MPOWER provisions, for instance. So it still has a long way to get to fully domesticating the WHO FCTC, although the legal framework is available now for it to be able to do that. And again, just to emphasize the point that a lot of what the countries are facing in terms of the types of diseases they're dealing with is really communicable diseases, malaria, HIV, TB, these sorts of things are the things that are typically at the forefront of policymakers, even within the ministries of health, and whenever they're facing any of the other ministries as well. These are the issues that they're facing when we come with this issue of tobacco control. Next slide, please. So if I just step back a little bit and look at the global scale, right? The latest WHO tobacco report on the global tobacco epidemic shows that there's been huge progress, right? Just over the last 20 years in terms of the amount of protection that the world's population is receiving from getting the highest level of achievement from any one of the MPOWER measures. We see that this is currently at 5.6 billion people, which is about 70% of the world's population that's covered by at least one of these measures. So that's a lot of good progress that's been made over the years. Next slide. However, the devil is in the details, as they say. And so really, I think some of what many of my colleagues have already talked about is that some of these have better sort of outcomes over time, whereas others have slightly less, have moved along slightly less in terms of achieving the highest level of outcomes of achievement for the MPOWER. So just looking at this particular graph here, you see that smoke-free environments, packaging warnings, and advertising bans are really the ones with the highest numbers. The dark blues that you see at the bottom there are the ones with the most complete policies, right? And those are the ones with the highest achievements or the highest level of implementation. In comparison, cessation programs, taxation, mass media are on the lower end. So there's really still quite a lot of progress that needs to be made for many countries around the world in these particular areas. Next slide, please. So where do these results actually fit in all of this? Well, first of all, these results are important in raising awareness. And I think that's really what they've done, right? They've created the interest in the fact that how big is this problem? What is the problem? Where are we seeing the issues? And we're seeing that this comes out in many of the numbers that have been presented already before. So 144,600 years of life years lost, right? I mean, contributing to 4% of annual deaths from smoking. Those are huge numbers, right? Especially when you're talking about Nigeria, these are huge numbers in absolute terms. And all of these come from the different diseases listed over there. on the public health side. So it's a huge problem already identified in terms of its impact on the public health side. Next slide, please. But the key thing as well is that this also highlights the economic cost, right? The fact that this is not just affecting public health, it's actually having an actual impact on the country's purse and will continue to do so for years to come. And that's something that the Nigerian authorities need to, sit up and pay attention to. And I think that's something that the ministries of finance would do well to do as well. So, the numbers already presented here have already been discussed. I won't really get into the details, but just to say that it's really the sounding board. It's the fact that the study is important in raising the awareness. And I think it's fantastic that it was local researchers that came up with this particular work. It's local data that's been used for this kind of thing, because that's the kind of data and level of research that many decision makers typically ask for when we walk into the boardrooms of ministries of finance to sort of advocate for these types of policies. They want to know, what does this mean for our country? You're giving us numbers from all these other places, but what does this mean for our country? So this is fantastic. It's great work. And it certainly sets the platform, I think, for greater work to even be done beyond this. Next slide, please. And just to sort of highlight that there are other things that have also been going on on the continent, and even beyond that, just relating to this specific aspect of investing in tobacco control. So, for instance, the UNDP, along with several other stakeholders, has been working on investment cases for tobacco control. I've highlighted a few of these, but this is just one of the platforms that they've used to try and enhance the knowledge around what's the impact of implementing or scaling up tobacco control in many of these countries. How is that going to benefit the country, both from the public health perspective, but also from an economic perspective, and really bringing that to bear in terms of the numbers and the methods being used to calculate all of these things. Next slide, please. But one thing that I think Dr. Adedeji also mentioned is the fact that political economy is a really big thing, right? In many cases, even if the numbers are presented, even if the good research is presented, there's still other underlying issues, underlying processes that are at play that still don't help move the needle in terms of moving policy forward. And so one of the other initiatives that's been, started by the WHO Alliance for Health Systems and Policy Research is this on understanding the political economy of health taxes in general. So it's not just looking at tobacco taxes, but alcohol taxes, SSPs, and so on, and all of these different things that might have some kind of impact in terms of non-communicable diseases on the continent. Now, while this looks at health taxes, it really does have quite a lot of implications for other types of interventions within the policy space for tobacco control, so MPOWER in general, because the political actors at play in these matters are typically the same. So a lot of the arguments, a lot of the processes, a lot of the things that are going to be said, and the different mechanisms in place to move the policy needle are going to be very similar. So these types of studies, the first cohort was already done in Ethiopia and Ghana. Those studies are complete. The second cohort one is currently in Nigeria, Uganda, and Zambia, and all of these are aimed at trying to understand the political economy factors that influence the design, adoption, and implementation of these types of taxes, not just at the national level, but at the sub-national levels as well. And I think that's something that Dr. Adedeji as well mentioned. So again, it's very complementary to things that are already going on the continent, and I feel like this is very timely in that sense. As well. I won't be able to speak about all the different interventions going on, but really these are some of the ones that I think were particularly of interest when I read the results, and I thought, what could be the best contribution for this. Next slide, please. So just in terms of parting thoughts, I think, as I've said, the African landscape is pretty complex. A fast-growing population, rapid economic growth, low adult prevalence at the moment, although that's set to increase because we have an increased youth prevalence, and also this focus on communicable diseases that's immediately facing most governments. And it's in that environment that we have to present convincing arguments to policymakers to take action now, because if they don't take action now, it's going to be a much bigger problem than what they're currently facing with communicable diseases and so on. We've also seen that there's quite a bit of progress in terms of implementation of MPOWER at a global level, but there's obviously more that needs to be done. And I think this is something that's been highlighted even by colleagues earlier, with respect to the different provisions of MPOWER. I've only highlighted taxation and cessation, which are the ones I think I highlighted earlier in one of the slides. But really, it's all the provisions of MPOWER that need to be enhanced. And also just to belabor the point that, local research evidence is really a vital piece. And this is what this particular study brings to the fore. And it's important for influencing implementation of strong tobacco control policies. But I also want to emphasize it's the first step. And it's beyond this step, taking this type of evidence into local action by the public and by decision makers, that's really going to be able to move the needle. So we need to take this evidence, we need to present it to the different, decision makers at whatever level that's required. We also need to send it to the public, because if the public is aware about this, they're the ones going to be able to move the politicians, the people that actually will then decide all of these things, to actually make the right decisions. And I think that's, where I'll end it for now. But thank you again very much to IECS, to CC as well, for allowing me to be able to comment a little bit on this. And of course, to the researchers that actually conducted the hard work. I know this is not very simple work to conduct. Costing is always a very, very difficult thing to do there. So I understand that's really, really great work that you've produced. So congratulations. And again, thank you very much for the opportunity.
Thank you, Doctor. Here, okay, so great, all the presentation in the resume of the situation of the Nigeria in Africa in this intervention and measure and empower was very, very, very interesting. So now we have a space to question and answer. We have a little minute because we have a time, but I don't know if there are any questions.
Nancy,
Yes,
can you turn off the presentation? And please, the panelists can turn on the cameras. So, okay, great. So we have a lot of questions, but I choose some interest one. I'm Ariel. I'm a senior researcher for this project for a long time, and I have the opportunity to work in different countries. And now somebody is asking about the rural communities. He mentioned the 𝗣𝗼. I'm not sure if the correct pronunciation, but how about the cultural differences that maybe some rural communities are affronting when we are trying to implement this kind of measure? What do you think about this? I think that
I suppose anyone. Okay, well, I'm not the expert on cultural issues, but I think it's an issue that we've come across at least once or twice in some of the other countries we've dealt with, and it's a fascinating question, and I think it's one that needs to be dealt with, obviously, with the sensitivities of the communities that are being dealt with. But I think one of the other things that needs to be, brought to the fore is working very closely with the local leaders. So we've already spoken at national level. We've spoken about, at state level, I think within Nigeria, but I think we also need to go even lower than that, right? Understanding the different facets of leadership within that particular community, and approaching them with obviously the facts that we know of the case of tobacco versus its burden on disease or its effect on people's human health. And I think bringing that to the fore and bringing that to the leadership and working with them and the different communities, church leadership, community leaders, and engaging with them to be able to bring the different facts and, again, the evidence, to be able to show the impacts of these different things on human health, on the economies, and so on. is a very big and important step in trying to change those types of cultural norms. Culture is something I think that is it's fluid in the sense that it moves with the times of what the people of that particular community are facing at the time. So yeah, so that's my thought. But again, like I said, I'm not the expert, but I think these are things that we've come across in many different communities. Thanks.
I agree with you. Nwokorie, I have problem with.
Okay.
I'm sorry.
That's not a problem. That's not a problem. That's a very important question, and I know somebody in this webinar is doing a research. His thesis is looking at tobacco, how it's being used, even in the bride price, while marrying in some part of Igbo land in Nigeria. And incidentally, that is the tribe I'm coming from, where they use even tobacco for bride price and all the rest of them. So, and like the co-panelists just said now, remember that there was a time, even in some parts of Nigeria, that they were killing twins, but it took advocacy to make them to understand that this is not right. So I think going further, based on presentation of Dr. Adedeji, taking the discussion of tobacco control down to the hinterland. As policies are being changed at the federal level, we will take it down to the hinterland to make them understand the implication of tobacco. And with time, I know that, yes, as I said, there are some cultural norms that have changed over time through advocacy, exposure. So, and I know that when we have people working on such research in their thesis, so when this fellow told us about his intent to work on that in his PhD thesis, we are so happy and excited and believe that he can get connection with people like IECS and other international people to help his work to deepen it. So that is another way to make the people in the rural community to know that, yes, this system of still using tobacco products for parts of their cultural norms is not the best. But I know it is a difficult task, but it's something that can be achieved looking at what has happened in other cultural norms that people were involved into, but today they're no longer involved into that. Thank you.
Thank you so much. I'm going to the next one. Is the government ready to comply with the several measures that are needed? What do you think?
For the question again, sorry.
Is the government ready to comply with the several measures that are needed? What's about the government position with the MPOWER measures?
Okay. Maybe let me start. I think people on the panel can also add. So in terms of, so I would say in recent years, we've seen some momentum around government policies. I mean, we've seen increments in taxes. They started around 2017 and 2018, 2019, government maintained a tax increase. In 2020, government slide a little bit in terms of further increasing it. So we've had some kind of momentum in terms of what government is doing. But what we are not seeing is two things. One is both step and one is more coordination. The both step is in terms of, for example, the Empower framework, in terms of taxation, one of the recommendations is that at least taxes should be around 75% of retail prices. In Nigeria, we see over around 15 to 20% in terms of retail price tax burden. And that is quite low. And I think the evidence of that is already clear that taxation doesn't really work as effective as it should be, because the burden and the level has not been implemented to what it should. So government has not been bold in its action. There are small little actions, but it has not been a big one that can actually make a big impact in that. The second thing is coordination. We are seeing government at one hand, like federal government, doing one or two things. We are seeing some pocket of activities in some states, but we are not seeing everyone working together. And I think that draws to the first question around how do we make sure that we make this a very collective action? Federal government has a role, private sector has a role, state has a role, local authorities has a role. How do we make all of this work together? I think that's actually the next step in making sure that we deliver that result on around tobacco effect control.
Thanks. Anyone? Sunda? Nwokorie?
No, I think Adedeji has really nailed it, so I'm not going to say anything beyond that.
Okay, perfect.
Okay. It's just to buttress the point he made, because we are discussing mainly Nigeria here. You see that here in Nigeria, at times you may hear an agency has done a lot of enforcement. Ministry of Health is not aware of that enforcement and they're not being carried along. But I think there should be a proper synergy. And that even a lot of times, I remember when we were trying to pass this act in 2015, you see people from government agencies opposing the act. People from government agencies, especially those from trade and investment, that all their languages has been money, job creation. So you see the same governments fighting among themselves. But if there is proper cohesion, proper coordination, they should speak with one mind. Know that this is for the betterment of the citizens and those living in the country. It's not because of any person, but you see that at times government people work in silos. This one will say our mandate is to protect businesses. This one will say our mandate is to protect health. Different things, and the industry will now lash on that and be causing havoc everywhere. So cohesion and coordination of government, various government agencies and processes, MDS, is paramount for us to get it right in this country. Thank you.
Okay, one more. This study received positive coverage in mass media. It was released in connection with World Lung Cancer Day yesterday, and is having a great impact in mass media. Do you believe that this type of visibility can serve as a facilitator to promote empower policies? Or not?
Andrea,
Which
sorry,
is the role of mass media in this kind of situation?
The role of mass media. Okay. Yeah, I can give that a try, I think. So I think one of the things that I mentioned just at the end of my presentation was the fact that I think we need to take these types of evidence that's been generated by the research team here and, give it out to the local, basically let it lead to local action. I believe part of that local action requires the public themselves to be aware of what the problem is and what the government needs to do about that problem. We have the researchers in this case identifying what the problem is, and we have the solutions in terms of the implementation of the WHO FCTC. So in my mind, I know it's not necessarily linear, but it's in my mind, it's quite linear. The relationship between what the problem is and what the potential solutions are is already quite set. So getting the public to a point where they understand, first of all, what the problem is and how what the solution actually is where I think mass media can actually play a critical role, getting that word out to the public, because that's only one side of the story. Politicians and others in sort of government administrations can quite easily get that kind of information and sometimes sit on it, and sometimes that's not necessarily their fault. It could be 101 other reasons other than perhaps a more malicious reason. But getting the public on side with these types of things through mass media campaigns will simply keep that issue front and center, so that the people that can actually make decisions are pushed to make the decision that's required to solve this problem. So that would be my take, I think, on how I think mass media can play a role in this. Thanks.
Okay, we do not have more time, but just a take-home message for each of you. A short take-home message, please.
Mine is just get the word out. You know, you already have you've got the research, get the word out.
Okay.
Let everybody know. Thanks.
Did you?
Okay. My own take-home message to everybody is tobacco in all its form is dangerous, from production to consumption. Stay away from it. Tell your neighbor when you're in place that people are smoking in public places, let them know that it's not good for you, it's not good for me. From cultivation of tobacco leaves to consumption, it kills. That is my message. Thank you.
DJ?
Okay, thanks. I mean, so my key message would be that action starts from governments, but it ends with each and every one of us. So on this call, I guess, as researchers and whatever role you have, we have a role to play in ensuring more kind of space for tobacco control. So let just find your own role within this space that we all make it work for everyone.
Thank you so much. We are going with Ariel for the closure. You're mute.
You're mute, yeah.
Thank you, Andre. Thanks a lot to each and every one of you. This webinar has been very significant for us, IECS, being the first webinar with the focus on Africa, with the results of our tobacco control model and the very rich input and feedback from leaders of the Center of Study of Economies of Africa, the Nigeria Tobacco Control Alliance, and the WHO CTC Knowledge Hub. So just to recap some main ideas presented by our Nigerian collaborators. Dr. Chibuike first discussed the current situation in Nigeria, highlighting the challenges in monitoring smoking environments, taxation due to inflation, and the influence of the industry, and the very well and the very good work of NTCA, and put an exclamation mark on the worrisome ineffectiveness of the MPOWER package in Nigeria, emphasizing the need for this to get this initiative enriched with knowledge. Then Dr. Adedeji provide strong background on what's the situation of tobacco control and related diseases in the countries, suggested some comprehensive measures, included absolute bans in public places, educational campaigns, legal frameworks and regulations, and advocated for an increased federal taxation on tobacco use and the use of persuasive approaches to reduce smoking rates. Finally, Dr. Zunda offered insights into the complex African landscape regarding tobacco control, highlighting the importance of identifying areas for improvement and showcasing the research agenda for Ethiopia, Ghana, Nigeria, Uganda, and Zambia for from the WHO standpoint. And so thanks everyone for giving us the opportunity to show our results, and we think we could make this also true for other countries in the African context. Thank you.
Thank you everyone. Sorry for the time. It was, thank you the panelists, and okay, have a good day. We have here the information of the website for you can follow our work. So thank you very much.